Vice President Mike Pence over the weekend called on Congress to repeal Obamacare by this summer. Dr. Ezekiel Emanuel was one of the architects of President Obama's Affordable Care Act. He's met with President Trump 3 times to advise him on his administration's health care proposal. First on CBS This Morning, Dr. Emanuel shares his solutions for higher quality and lower cost care in his latest book. It's called Prescription for the Future. He writes, although the next few years may be rocky, the American healthcare system will ultimately become better performing and more affordable in the long run. A lot of people sure hope so. Dr. Ezekiel Emanuel is chair of medical ethics and health policy at the University of Pennsylvania and joins us at the table. I hope you heard Senator Manchin. Hello, Dr.
Hi,
Zeke.
how are you?
I hope you heard Senator Manchin say, listen, millions of people now have health care that didn't have it before. They don't want to lose it. But we all know that it needs to be fixed, he says. Yeah. Would you agree that it needs to be fixed? You're one of the architects.
Oh, absolutely.
You have some solutions to fix.
We've had unintended consequences from the Affordable Care Act. We've had problems that were in the bill that we couldn't solve before it got enacted. And it's been around for 7 years, so some of the problems have become obvious. Any corporation that would do a massive change like this would make constant adjustments. Because of the paralysis in Congress, we haven't been able to make those adjustments. We know there are repairs needed. When
Everybody says that, but what do we do about it? What to do? Yeah.
Well, on the exchanges, there are 3 very simple things. Enforce the mandate, guarantee the subsidies to the insurance companies for cost sharing, the deductibles and co-payments for families making less than $60,000, and make sure that the insurance companies have what are called risk corridors and reinsurance so that if they get too many sick patients, they're protected against that. Those things, 2 of them were in the ACA, but the Republicans undid them. We just have to do those basic things. And everyone knows it's those basic things that will help.
Before all of that, one of the things that drove opposition to the Affordable Care Act was massive increases in premiums.
Right.
That perhaps the Obama administration did not accurately predict or prevent.
So, first of all, we need to be accurate. The healthcare inflation rate has actually stabilized under the Affordable Care Act. In certain markets, like some of the exchanges, you have seen very steep rises in premiums. There are things to do. There are many cost control measures. And one of the things I would say is the Republican bill has literally zero cost control measures in it. They're not going to address affordability. I totally agree with you. Affordability is one of the things people care about. Affordability and quality, they want to make sure they get good quality. And what my book is about is how can we improve the quality of the system and lower the cost. That's very possible.
And can you do that without mandates? Because that is what drove the opposition to Obamacare.
The answer simply, Charlie, is no. Yeah. You need everyone in the system. You can't just have the sick people in the system and the healthy people waiting until they get sick before they buy insurance. That's just the simple fact. And we're going to just have to accept that fact. You can either have mandates or you can have what's called auto-enrollment. You just get basic coverage.
You hit 2 things in your book on how you choose the best doctor for yourself. There's 2 questions you should ask.
Right.
Tick them off for me. 1, 2.
The first one is, do they do open access scheduling?
Which means?
Open access scheduling means that they start the day with half of their appointment slots empty for people who walk in or happen to get sick or happen to find that they have the time and they need that checkup done.
Yep.
So open access scheduling is very important. It's so that the doctor doesn't say, you know, I'll see you in 6 weeks.
6 weeks, right.
Or I'll double book you and everyone's waiting and being annoyed. And the second one is, are they on some performance measurement plan? Do they have something like patient-centered, are they a patient-centered medical home so that they're measuring their performance and trying to improve it? That is key because we want doctors who are going to do better and know how well they're doing. So open access, and are they on performance measurement plan like a patient-centered medical home? And I would ask any doctor about that.
Dr. Ezekiel Emanuel, thank you. We are out of time. They're telling me
okay.
No, they're going to yell at us.
Okay.
You know how they yell at us. Keep going.
I hate being yelled at.
I know. There is so much.
There's always more to talk about when it comes to health care.
There really is, and you've got a lot here. Prescription for the Future goes on sale. We'll be right back.